Vanakkam. Very good evening. Dr. Ravichandran, Dr. Khanna, Sri Balaji, Dr. Sundar, brothers, sisters, daughters and sons, everyone in the house. Very good evening to all of you. When Rudra called me and asked me whether I can participate in the program, I was not knowing what I was getting involved in. After coming here, I realized I made a mistake. After this two renowned doctors giving a very most serious lecture in a humorous way, we are following by an actor who is kept all of you laughing all the time. Here is a Karmi scientist. How can I follow them? And I am really pleased that I came here. I should have come here to listen and not talk. I think if I had listened to Mr. Rajinikanth before, I would have certainly been wiser. But they showed me this only after coming here. Maybe they thought I wouldn't accept. Dr. Khanna pointed out that regardless of the disease burden related to kidney, running into millions and so on, regardless of how small a group we might be, that we ourselves might have in our families, relatives and friends, somebody who has got this kidney dysfunction. It is by coincidence that one of my colleagues, who later on became the director of Central Research Institute, who succeeded me, had his wife operated upon with a kidney dysfunction by Dr. Ravichandran at that time. That's something like, 26 years ago? Well, it so happens, I was the director of the institution at the time, so I had to clear the medical bill. So, it was at that time, for the accountants who control the expenditure, it seemed a large expenditure. And I wrote on that file, don't look at this as an expenditure, look at it as an investment into the life. And that's what he has done. And it also happens that before I get into the main topic, one of the very young girls whom I knew when she was in class 4 was diagnosed some 6-7 years ago of a globular basement membrane disease. Because she's so very close to me, and I'm a scientist by faith, not by profession, I went ahead and searched through this globular basement membrane situations. Then I realized it's a genetic disease with a very rare disease burden. 1 in 20 lakh people suffer from this, and 80% of them happen to be, according to the report, white males. Here is a girl from Thirumalachari, and a lady who suffers from this globular membrane disease. And I then retired from the government, so I still had very strong emotional connection. Sometimes friendship is a very difficult one because it's very difficult to manage, because you persuade some people, right, look at this, and it's a collagen related disease. Basement membrane. Leather is made of collagen, so I know a little bit about them. And I asked several of my friends in this country to undertake research in this domain, and I was willing to arrange the research funding at that time. And then I realized all of us who have normal health, I am not using the word sound health, I am using the word normal health. We take that health for granted, and we therefore tend to indulge and sometimes even abuse the body. And what doctors are saying today, hey, don't abuse the body, use it properly. That's a strong message that I had given. It's by coincidence the years that Dr. Ravichandran mentioned about his initiatives had to be coincident with what my journey had been. He talked about low salt initiative. And it turned out, the day I was appointed director of the Research Institute, very same day, Supreme Court closed 400 tanneries in Tamil Nadu. They would have waited for a day at least. And many of you might think the tannery problem of pollution is originating from this and that. The most serious problem of tannery pollution is common salt. So he talked about low salt, I talked about no salt. It was the year 1997, 96 I had become the director. It took several months to get the Supreme Court to give me permission to operate these factories and operate. So we worked with 764 tanneries simultaneously and worked out this low salt, no salt issues. And we got all the 764 tanneries comply with the regulation at that time, not 18 months, in 9 months. And we charged them about 4.5 crores. That's a different matter. But although we treated them, the one problem that we could not solve in 97 was what to do with the salt, common salt. This common salt, which we all take it for granted like our health, can be a common rogue. It can create lots of problems. And finally, before I left this town to Delhi, we ensured that no tannery in this state of Tamil Nadu discharged a single liter of wastewater. Everything was recovered. Common salt was removed by dialysis, by reverse osmosis. Coming to you, even my chemistry is getting changed into dialysis. See what the doctor has done. And reverse osmosis has become dialysis. And it's anyway, the science is so common. And it turned out that we ensured that the salt recovered from the tannery waste was reused in an electrochemical alkali industry, chloralkali industry, and therefore no salt gets out. Tamil Nadu has been practicing zero discharge of liquid from 2005, before I went. But it turned out, I went to Delhi in 2006, and that's the time apparently they decided to have a World Kidney Day, beginning of this period of time. I do recognize that while majority of us who probably have not been health challenged in a very significant manner might take things for granted and give importance to sometimes organs which are very visible. Somebody was saying, doctors were saying that the blood pressure is root cause is in kidney and heart is the sufferer. But we worry about heart. There are people who are told you're heartless. That's a different matter. But fundamentally, the major message that was delivered today, what does kidney do? Is to ensure that the health system that we have is maintained. I'm not using keeping, I'm using the word maintained. Carefully, I use the word care in this particular case, to ensure that other part of the body is reasonable. So essentially, all other parts of the body, which are more visible in the terms of giving trouble, had maintained by this particular process. It's interesting that in our culture we always refer to people by initials. I was telling people keep calling me TR so much that I forget my name is Ramasami. And here is another RC. and everybody talked about this RC. And I think what message he delivered, the reiteration process, is really is asking everybody to have responsible conduct. I'm not using the word RC in this particular case, not care, conduct. Because don't take salt. You mentioned, followed up, my Mr. Brent Balaji followed him in a wedding party and find out he took only 4 dishes out of 30. And that's a conduct, responsible conduct that we talk about today, which is in the hands of every person. It is not in the healthcare system. An individual is really the center of conducting oneself appropriately, and that's what was mentioned before. And he also talked about when you go to a person, right consultant, because there are people in a profession who does what is acceptable to the patient. But you go to a doctor, as Mr. Rajinikanth was saying, that many of them came and ate in his house and said food was fantastic. But then somebody came back and said, no, the food is no good. So there has to be the right person to essentially caution you. So that is what talking about another RC that comes into this process, and majority of what the patients that have gone to him have got the right advice, which is an important process. Fundamentally, in a situation such as this, at an individual level there are issues, at the medical professionals there are issues, but there has to be a system, an ecosystem, a healthcare system, and the right healthcare system is crucial. And it turns out that some of these major illnesses don't get as much attention as it should be. I do remember moving a case in the government to provide support to a private sector for grants for phase 3 clinical trials of neglected diseases. It turns out that particular day I couldn't go to the meeting, so my cabinet secretary took a decision in the system that I will go and explain this to the finance minister and get this cleared. So I went to the finance minister, and he said, "What do you want to give money to the private people for this?" I said, "Sir, there are no such thing as a neglected diseases. These are diseases. These are diseases suffered by the neglected people. And can a government of India afford to neglect people of this country? There are diseases which are, they use the word orphan disease, but there are neglected diseases also. Neglected because the people who suffer in that illness don't have enough payment to pay back. And eventually, we did get that cabinet decision move, and we supported cabinet clinical trials for phase clinical trials, support grant, international grant, national grants, and we were able to find 9 leads because of this one decision. So there is a necessity for a right system, a decision system which is important. And I believe in a situation such as this, where large number of people are suffering such difficult conditions out of ignorance. And basically what this is all about, this movement is all about, not only awareness, but you provide education and make sure that individuals behave responsibly. And I believe in today's talk, today's presentations, I will go back learning as a learner from this group to be a responsible individual who ensures that I don't take my system for granted. Ask myself, how do I behave myself? Conduct is important. Fortunately, doctor, without all this advice, I moved into the no-salt position for a long time. And especially after my experience, I used to call myself the highest paid cobbler of India. And when I was the director of the Leather Institute, And I saw the problems that came out of salt to the agricultural systems in place. And I believe more than industrial wastewater, the common salt that we as human beings excrete is sufficient enough to spoil agriculture. Because the municipal waste also contains enormous amount of common salt. So essentially part of an ecosystem management, all of us have to behave ourselves in a responsible manner. I am mightily pleased that today there's a lot more awareness in the system, and suddenly you find in Chennai everywhere there are walking paths and exercise towns, and I think people are becoming conscious of these requirements. But I think the medical profession itself, I think at least from the perspective of the Indian system, I think Chennai city can pride itself of a reasonably credible healthcare system. You see, I myself was a patient of Dr. B. Ramamurthy. When I had a skull fracture when I was young, when I was 16 years old. And BR is considered those days the god of Indian neurology. But how many people he himself could have saved? But today, the system in this city is so good that I think so many brain surgeries are done in this town with a very high degree of success. And that's because I think we should thank all these medical professionals as a community that they have strengthened the infrastructure, intellectual infrastructure. I'm not about physical infrastructure, intellectual infrastructure, and a kind of healthcare infrastructure. And I believe in this whole gamut, what we require is a responsible healthcare system. It is even today, I must say, majority of the healthcare system rests in the family and the individuals. But what is important is to really make this into a socially aware and conscious system. They talked about equitable care, health. There are 3 criteria which are important. First of all, we need to ask whether there is an available treatment for a disease, whether it is available, whether it is accessible, whether it is affordable. It turned out in 2009 my mother fell down. She had broken hip. And we carried out 2 surgeries and eventually got her to do things right. She was 80 plus. So I was secretary at the time, and my sister-in-law was asking, your mother is coming home, why are you looking so glum? No, I'm not good by my mother will come back home. But the total expenditure incurred is 14 lakhs. And how many families can afford this treatment? It is available because she has been. It is accessible, but not affordable to many. So today, in this kidney function, I am aware a very large percentage of this treatment costs of kidney functions is very unaffordable for majority of the people. That's why these 2 doctors are saying prevent. So treatment is going to have a certain burden, but preventions. And all the time, really itself, prevention is better than cure. I believe this entire movement that the foundation is trying to do is focused on prevention. And there are very few doctors who will talk about preventing a disease. I won't mention it in later vein. A very dear friend of mine who is a neurologist. And I went to his chamber. And he was looking at MRI. He said, oh, what a beautiful tumor. I said, what are you saying? Poor guy, that fellow is suffering. This was said. Fundamentally, there are very few doctors who focus on prevention. I am very mightily grateful for these 2 great men to talk about prevention. Cure is necessary, but prevention is wise. I think they are recommending wisdom over even knowledge. And I am very grateful to you that you got me to this program. You have given me a fantastic education, and I go back and ensure that I practice everything that is practiced. So today, I'm already 75. Therefore, I've lived enough. But I would like to live well for the remainder part of the time. And I thank the doctors for this opportunity.